We're going to turn things over to our medical correspondent, Rosemarie Beltz. She is here with two physicians who are experts in the area. So again, facts, not fear, Rose.
Thanks, Darcy. So we're here with Dr. Perez from Lex Medicine and Dr. Ahuja from Prisma Health, two infectious disease doctors in the area who will be answering your questions throughout the show.
All right, so let's get a couple of those questions in. We've been getting them from our viewers over the last couple of hours, actually since as early as, what, 6, 7 o'clock this morning.
One question from a viewer we got on ZipWhip today we would love for the doctors to answer is this an airborne illness? Because we haven't exactly been told yet the way that we could potentially contract the virus.
Which one would you like to take?
I'll take it, yeah. So, yes, it is an airborne illness. It's transmitted through particles that go into the air. And that the reason that, you can get the infection is because you inhale those particles. Now, that's why people wear masks when they're dealing with patients that have the infection. But also you have to keep in mind that this infection can be transmitted by touching surfaces that have been contaminated. So if you touch your nose, your mouth, after you shake hands, after you touch a doorknob, you can catch the infection as well. So even though it's airborne or transmitted through air, it can be transmitted through other means as well.
So Dr. Perez, how would this differ from the flu? Let's say, if people can put it into context.
So the flu and this virus, the coronavirus, are both respiratory viruses, and the transmission is actually essentially the same. There's a component of the airborne inhalation of those particles, but also people can catch the flu from being in close contact with other people. The flu is more of a respiratory deep infection versus the coronavirus tends to be more upper respiratory.
But with that though, are you guys speculating that it's staying airborne longer than maybe the flu? I think that's the concern where the masks come into place.
So just to sort of follow up on that, it is certainly an airborne illness, but the dynamics have not been sorted out totally. There is person-to-person transmission, initially started from animals to humans, and now it's happening person to person. And as Dr. Perez said, inanimate surfaces, doorknobs, etc. are as bad, but it's mainly respiratory. And what's recommended in the healthcare settings is the N95 mask.
Great. Okay. Thank you so much. We're going to get more into the masks when we come back. Ladies, back to you.
All right. Thank you so much, Dr. Perez, Dr. Ahuja. We will check back in right after this. All right, we are still taking your questions tonight, 776-9508, to ask one of our medical experts. And we have a specific question we want to get to because this is something we have seen a lot on our News 19 Facebook page. Can imported products coming to the U.S. from places like China carry the virus with them? So for that, we want to toss it over to Rose and our panel.
Thanks, Andrea. Dr. Ahuja, would you like to take this one?
Sure. I think most of these products take some time to get to the United States, so the likelihood that the virus is going to survive for too long is unlikely. Having said that, I think everybody, whether it's the CDC or the Chinese authorities or other people around the world, in Italy, the WHO, are still trying to figure out the dynamics and how long this virus can survive outside the body. As you all know, there have been cases where patients have transmitted this virus without having a fever or symptoms, and then there are cases of patients getting this virus without any known contact. So how did this person in California get this? Was it secondary or tertiary transmission from one person to another, and this person is still being worked out? But in general, the risk of an imported product transmitting this virus after having spent days in shipping and transport is low.
Thank you, Dr. Ahuja.
I think that's good news. I want to ask another question now, and this is something we have talked about on News 19 quite extensively. Do these masks actually work? Because we know even here in the Midlands, in places like Lowe's and pharmacies, they've sold out of these masks. So doctors, what do you recommend?
Dr. Perez from Lexington Medical Center, would you like to take this?
Sure. So the masks definitely help. I mean, this is a virus that is transmitted through the air. Now, that doesn't mean that everybody has to put a mask on as a precaution as of now, but in the setting of being in the hospital or being in a household where somebody has been exposed or has the virus and the infection, it definitely helps to have the mask. But it is kind of too early to say for sure if people need to really be, gathering masks to be protected, because for now the CDC has not recommended those precautions unless you're in the hospital.
So with that, just to elaborate on that a little bit, so the person who is sick should be wearing the mask too. I just want to get some confusion around who actually should be protected.
So the person, one of the protocols we have to evaluate these patients is if the patient is going to the doctor thinking that may have been exposed to the virus, the first thing we tell them is to put a mask on, because that will decrease the chances that that virus will go into the air and infect other people. So definitely the patient should be wearing a mask if they are in the context of being able to expose other people. Like if they're in a medical office or if they're in the emergency room, we immediately put a mask on those patients that could be a potential case of the virus, and we put them on a separate room where there's little contact with anybody else.
So as part of being prepared, should people buy a mask, or what are your thoughts on this?
I think the one thing is if we can send one message to everyone, is that not to panic. This is a viral infection. Just to put it into perspective, last year we had almost 45 million cases of influenza just in the United States. So out of a population of 330 million, we had 45 million cases of influenza, tens of thousands of deaths from influenza. This year the influenza epidemic is supposed to be worse. So I think in perspective, this is something to be worried about, but don't panic. There are much bigger and worse things that are more imminent that you should be concerned about. And if you were to do one thing, hand washing, hand washing, hand washing. That's probably the best thing to do, and not touch your face 20 times a day like we all have this habit of touching our face.
Great information, Dr. Ahuja. Andrea, back to you.
All right, yep, Dr. Ahuja just answered another one of our questions from our News 19 viewers about the difference between the flu and this virus. You can keep texting in your questions, 776-9508. We'll be right back.
All right, Andrea, thank you so much. 803-776-9508. That's the number to dial to text in your questions so we can get our panel of experts to answer those questions for you. Today, it is facts, not fear. These are your questions. Someone sent in a text message wondering, can your pets get the coronavirus? Rose.
Thanks, Darcy. I don't know. I'm a dog owner. Something. What do you think?
Yeah, so we have dogs and cats, and I think so it's not clear yet. We do know that this virus probably started from animals. It's still not clear whether it started from bats or what are called civet, C-I-V-E-T cats in Wuhan, went from animals to humans, and now is going person to person. It's not clear if we can transfer it back to pets, but I did see a blurb on either the WHO or the CDC website that if you think you have this infection, it might be better to stay away not just from other humans in your household and in the community, but also stay away from your pets. It's just not clear whether this can go back to pets.
You made a really good point. If you think you have this infection, I feel like the symptoms are so synonymous with the flu. How do you know? Like if you're traveling, what is a good indicator that you maybe should go get tested?
So the likelihood, so at the present moment in the US, there aren't that many cases. Most of the cases are in mainland China. If you haven't been in contact with somebody from mainland China, if you haven't traveled from mainland China, if you're not a healthcare worker who's been in the lab or been in contact with somebody with this virus, the likelihood of you having this novel coronavirus, or what is now called COVID, COVID-19, is extremely unlikely. So the thing is not to panic. There are guidelines out for every healthcare facility. The main criteria are you need to have an illness like flu, and you need to have had some contact with somebody with this virus, or you need to have traveled from China. But again, this is going to change because there are now cases in Italy and South Korea, so the definition will change. But as of now, it is not as widespread that it's unlikely to suddenly go all over the place. But the experts say it's not if, but when this comes to more places in the U.S.
Thanks, Dr. Ahuja.
So we've got another question in. As infectious disease experts, I know you guys will be able to handle this one. Is it true that I need to shave my beard to be protected against the coronavirus? Dr. Perez, is that a question you want to answer?
I'll take it. So it is true that to wear a mask and to have the mask fit well so you don't inhale those particles that are through the air that transmit the infection, you don't want to have a beer, okay, because a beer will interfere with that seal of the mask. But if you see an infectious disease doctor with a beer, you're probably still okay to keep your beer, okay? Because at this point, we don't have a level of epidemic in this country, like Dr. Ahuja was saying. So for you to start thinking about shaving your beer is probably not necessary. If you see me without a beer, maybe think about it.
Great. Thanks, Dr. Perez. Darcy, back to you over at the monitor.
We've been asking you all day to send in your questions, and I think this is a really important question from a News 19 viewer. It says, I work in a very large plant. What do you think is the best precaution to prevent or control the virus if it spreads there? And I think that this can be said for colleges, for schools, any place where people are in close proximity. Doctors, what do you think about this one?
So it is true that in places where there's crowds and a lot of people and you're going to be interacting with a lot of people, there's some higher risk of acquiring the infection, both through the airborne route and also by touching other people, shaking hands, going to the bathroom where people have been before. So the best thing you can do to prevent or avoid catching the infection is this. Have one of these at hand. Wash your hands a lot, cover your cough with your elbow and with a tissue, and use the common sense measures we recommend for other infections, which are basically do a lot of hand hygiene with soap and water, with the sanitizers, and if you are sick, stay at home, don't pass it on to other people. So that's another important thing to do, is you stay away from other people if you feel you're sick.
So, and we're going to piggyback off that, talking about the whole testing process. So say you think that you might have been exposed. Why maybe some people are getting tested, why maybe some people aren't. Dr. Ahaju, if you would like to take that.
So the testing for this coronavirus is new.
It's not a mosquito.
Is new to humans. We haven't been infected with it. So none of us anywhere in the world really have any immunity to this virus. And just a separate note, coronavirus is nothing to freak out about, because 5% or 10% of the common cold that we all get is due to this coronavirus. This coronavirus is a novel coronavirus. It's new, and that is why there is no easily available test for it. The tests that are done routinely in the hospitals don't test for this. Neither the PCR, which is the polymerase chain reaction, nor the cultures. So if this is suspected, the sample has to be sent to a public health laboratory, and then our South Carolina Health Department sends it to the CDC in Atlanta. There may be a commercially available test, but it's not ready for prime time yet. But just one more note, our health department has constant updates. They're doing a phenomenal job of keeping up to date with this. So if you have questions, log on to SCDHEC, South Carolina Department of Health and Environmental Control, and that can give you some good sense of what's happening in South Carolina and around the country.
Great. Thanks so much, Dr. Ahaju. Andrea, back to you.
All right, thank you so much, and thank you to everybody who submitted questions. We're going to try to get to as many of them as possible. Going to take a quick break and be back with more right after this.